So this diaphragm, which is clear down here at the level, it attaches itself, the level of the spine at L1 and 2, originally migrated from all the way up in the neck, and its innervation comes from, and you can remember this, C3, 4, and 5 keep the man alive. Okay? That's where the innervation for the diaphragm originates from. Kind of interesting, isn't it? I think it's absolutely fascinating. C3, 4, 5 keep the man alive. Okay? Just something that helped me to remember when I was learning this. But that's because that diaphragm actually originated clear up in the neck, and that gill space then migrated down as this area matured. All the way down to the diaphragm now is C3, 4, 5 innervation. And yet all the sensory over that is clear down at the level of T10, T11, T12. Thoracics that are over 8 to 10 to 14 segments away from any upper innervation. Kind of phenomenal. I think it's fun. Anyway, so as we look then here, if these are some of the causes, how are we going to then treat the cause, okay, of asthma? Many researchers have actually found that one of the other causes of asthma is deep-seated emotion of sadness. In Chinese medicine, the lung fields represent unresolved grief and sadness.
The what?
Okay?
Sorry?
The lung fields represent grief and sorrow or sadness. Okay? Unresolved grief and fear actually can lead to depression. So asthma has then a concomitant physical manifestation potentially of an emotional state. Think about it this way. If I'm angry, my blood pressure may go up, my cheeks may turn red, and my fists may clench, and I may grip my jaw. I'm angry. Okay? If I'm happy, I may smile. If I'm sad, I may have tears. And each of those is a physical manifestation of emotional state. Depending on how deep that emotion is, oftentimes we see it linking or leading to a potential cause of an asthmatic response or an obstructive or a constricted airway. Okay? Have you ever found or been or told something that was alarming or sad and found it difficult to catch your breath when you heard that?
Like there's a strong sadness, grieving or whatever, you're crying or something, a lot of times it is
hard to catch your breath, isn't it? Interesting. And that's actually a vagal response or a parasympathetic sympathetic response. Okay? Pretty neat. So sometimes it means that we have to treat sadness and grief. Okay? Before we leave tonight, I'll show an example of how we do that. Okay? So athletic-induced sadness or grief or emotion, allergies, infections. Allergies, not only respiratory or airborne allergies, also food allergies. What's a primary food allergy that causes obstructive airway or constricted airway disease?
Nuts.
Nuts are common. Yep, very, very common. A lot of kids have allergies to milk. Okay? Soy is a very common allergen trigger when we look at this. Most common one though I see is the dairy. Anaphylaxis is often with nuts. Okay? You'll see a lot of people with nut allergies. You know what's interesting about nuts? Nuts are very laden with mold. So it's actually an infectious response to mold. Okay? If you look at, I don't know if any of you have ever worked with bulk nuts. Have you ever opened up nuts and seen how quickly they mold? Especially pecans and walnuts. I worked once where we got large boxes of nuts. We were doing different candies when I was in college, and they would actually bring in nuts. We'd open up the boxes, and the first thing you have to check them for is mold. But it's interesting. That's a lot of times we suggest that you soak the nuts, right? Not only to make them alive, but then to also put a little bit of salt with them to actually kill the mold that's on them. Nuts, especially peanuts, grow close to the ground, and what we find a lot of times is that those plants or vegetables, especially potatoes, that will mold quickly. Strawberries, how quickly do strawberries mold?
Really fast.
Like overnight, right? Those those types of berries that are close to the ground will mold very quickly, and because of the mold spores that are associated with them, a lot of times we perceive them to be allergen triggers, when actually, actuality it's a confused immune response against the mold that's around them. Okay, so that's another key. Inflammation again then as a either some type of a paint or a sensitivity to chemicals, something we're breathing, and then we're looking at the bronchial spasm. Okay? Any questions to that point? Okay, let me then just show a couple of key things that we have found that are very effective in treating or helping to reduce the bronchial spasms. I don't know if you can do this on camera. There is a company called MediHerb, and MediHerb makes a product called Resco. Resco has been proven in the research to aid in relaxing bronchial spasms, and we found it to be very, very effective. Okay, so that's something that I just showed. And then another thing that we found from a company called Apex Energetics is something called lung terrain. And for children who've had infections and coughs and a bronchitis, we use this a lot of times just as a drop to help to restore the natural response of the airways to air when we're breathing from going from warm to cold. Think about it at this time of year when it's 70 degrees in here and outside. This morning it was 14 when I came in, right? That's a big span. Well, how do our lungs respond to that? Thank you. They're going to respond by, in essence, putting their own sweater on. And they'll lay down some heavy phlegm, or they'll constrict to try to keep that cold air from coming in. So a lot of times we'll recommend that children and even adults put some type of a scarf or a mask. Jen, when you're skiing, it's really cold, you're going to put some type of covering, right? When we go snowmobiling, put some type of covering so we're not breathing that cold air. Well, why do we just run straight from the house to the car? Because we don't have time to put on a coat, right? We don't have time to put on a scarf and cover ourselves. But that actually creates a major insult to the lungs. So one of the best things is prevention, right? Next thing that we very commonly find is with the asthma, people who have long-term asthma will actually have enlarged muscles in the front. These are called accessory breathing or accessory breathing muscles. Okay, the diaphragm again is the primary breathing muscle down here at the bottom. The intercostal muscles that are between the ribs have a response to lift the rib cage out and open and then also forward. But when a person has very obstructed airways, they feel like they can't get that air in or that constricted airway, so what they'll do is actually use their accessory muscles in the neck, and when you feel the neck muscles in little children, they'll have these hulking neck muscles on the sides that are lifting up the upper ribs. Okay? Oftentimes what we find is that creates an alarm response in the body, and the stellate ganglia, which is part of the sympathetic nervous system, if we can start to change that, one of the best things we've found to do is a standing adjustment where you actually reach around from behind and lift quickly over the first or second ribs to open up that airway again. And that can be very helpful. Okay, so sometimes it's an adjustment. The other thing that we find besides supplementation and adjustments again is eliminating infection. So if it's a mold infection, we want to get rid of that. If it's some type of a toxin, eliminate the toxin. If it's some type of an inflammatory response, anti-inflammatories. Albuterol can be helpful in emergencies, but we've actually found again with the Resco that it can work as effectively. The challenge is it's a tablet and can be difficult for smaller children to take. Okay? Those are the primary ways that we treat asthma, and then there is an emotional way too. So